If your body were not able to react quickly as you go from a lying to a sitting or standing position, blood would pool in the legs and you would faint from temporarily decreased blood flow to the brain. Instead, changes in position, that is, lying to sitting or standing, normally trigger reactions that act to rapidly redistribute blood flow so that adequate blood pressure is maintained to the brain and other vital organs. You can tap the play button between 1 and 2 to see the body's reaction to going from a lying to a sitting position. You can tap the play button between 2 and 3 to see what happens upon going from sitting to standing. You can choose the impaired state and repeat this process to see what happens when the sensing or affecting mechanisms are impaired, for example, by certain medications or diseases, for example, Parkinson's disease. You can also tap directly on the numbers to jump directly to the lying, sitting, or standing stage. Here are some key points about these changes to keep in mind as you use the diagram. The blood distribution in the body is represented in the diagram by the schematic red tube along the length of the person's body. When lying down, blood is relatively evenly distributed. In real life, it's not quite this evenly distributed. A higher fraction is in the central or larger vessel circulation, but this simplified model serves to illustrate the main points here. You can watch the progression from 1 to 2 by tapping the leftmost play button. As the person goes from lying to sitting, you can see that the systolic blood pressure drops slightly and is then restored, although not quite back to the same level as when the person was lying down. As you play this same sequence again, now focus on the change in cardiac stroke volume and the subsequent events. As blood begins to pool in the most dependent, that is the high capacitance veins, venous return to the heart decreases and SV therefore decreases because of the lowered preload. Review the Frank-Starling relationship diagram if this relationship between preload and SV is not clear. Decreased SV leads to a slight temporary drop in blood pressure, which is sensed as decreased stretch on baroreceptors in the central arteries, the carotids and aorta. Neural signals, in this case decreased neural firing, from the baroreceptors are transmitted to the medulla. Based on changes in the baroreceptors firing, the medulla increases sympathetic nervous system outflow or tone and decreases parasympathetic nervous system outflow. Increased SNS activity and decreased PSNS activity lead to increases in heart rate, abbreviated HR, and contractility. These changes act to restore SV, although perhaps not quite back to the same level as lying down, given that venous return and hence ventricular preload remains slightly below supine or lying down levels even after compensation. Review the PV loop and contractility diagram to recall how contractility affects SV. Blood pressure is kept from falling further as a result of this adjustment of the autonomic nervous system. Increased firing of the SNS also increases vascular tone, and this is another mechanism that acts to counter the initial drop in blood pressure. When moving from lying down or sitting to a standing position, activation of leg muscles necessary to stand also activates the muscle pump action that moves blood back through the veins toward the heart, thereby countering pooling of blood in the extremities. As you tap the rightmost play button, watch the progression from 2 to 3. The same process we described above is repeated, with an initial drop in SV leading to changes in baroreceptor firing, in turn leading to increased SNS activity and decreased PSNS activity, ultimately resulting in increased heart rate, contractility, and vascular tone, all of which counter the drop in SV and blood pressure. You can tap Impaired to switch to a state in which the compensatory response to postural change is impaired. Tap on the number 1 to go back to the start of the animation and go through using the play buttons. With impairment of the autonomic nervous system response, the main difference is that the pooling of blood and subsequent decrease in SV is followed by a diminished response of the autonomic nervous system. You can see this by the size of the arrows next to SNS and PSNS as you play the animation. With this diminished response, SV is not restored to a normal level. This is indicated by the down arrow that remains next to SV. The blood pressure drops significantly. A drop of at least 20 millimeters of mercury in systolic pressure or 10 millimeters of mercury in diastolic pressure is generally considered significant. In the diagram, systolic blood pressure is shown going from 120 millimeters of mercury lying down to 85 millimeters of mercury standing up. This type of blood pressure drop with postural change is termed orthostatic hypotension. There are also other types of impairment other than the autonomic nervous system impairment shown here that lead to poor compensation in response to postural change. Low blood volume, for example, from a significant hemorrhage, may leave the tank too empty for proper compensation.